Davis, registered nurse. Much has been written regarding the emotional stress and fatigue factors associated with the nursing profession, but little has been done to help nurses combat the physical stress and fatigue factors associated with their everyday work activities. We are going to discuss a few basic principles of movement which can reduce the amount of effort needed to carry out daily patient care. This program was prepared to serve a need, a real need, of the nursing profession, which has the highest incidence of job-related back injuries of all professions. Would you believe that over 93 million lost workdays each year are associated with back injury, and over $5 billion are spent on back injuries annually? We hope to reduce personnel stress and fatigue to minimize the danger of injury to you and your patient while helping you conserve energy and prevent back injury. One of the most difficult principles to employ while delivering nursing care is proper body mechanics. This program was designed to show you correct body mechanics to be used routinely in your workday activities in patient care. In this presentation, the following topics will be: wheelchair safety and proper lifting techniques, turning and moving the patient in bed, and transfer techniques using minimal to moderate assistance and transfers requiring maximal assistance. We will review the procedures using both the one-person transfer and two-person transfer techniques. Since each technique will not work in every situation, we will explore alternatives that will reduce the amount of work you are presently doing and prevent you from injuring your back. For a quick review, there are 6 principles of good body mechanics. These 6 principles are gravity, center of gravity, base of support, leverage, friction, and inertia. We will be referring to all of these terms throughout this presentation. Now, let us look at the basic parts of a wheelchair because it is important to know these parts and refer to them. They are push handles, backrest, armrests, hand brakes, tip bar, caster wheels, and footrests. Let's begin now by reviewing principles of wheelchair safety. For safety, always lock the wheelchair. When a patient is left unattended with the wheels of the wheelchair in the standard position, falls can easily occur, even though the patient may be secured with a posy-type restraint. To prevent the patient from tipping forward in a parked wheelchair, simply reverse the front wheels by pulling the wheelchair backward. This simple procedure increases the base of support, thus preventing the patient from tipping the wheelchair forward. Moving a patient from a slumped position to the upright sitting position can indeed be a difficult task. However, with good body mechanics and an understanding of the principles of the lever system, both the back-breaking task of lifting a patient can be eliminated and the amount of work reduced for the nurse. One way this can be accomplished is the front pickup. To move a patient using this method, the nurse must first position the patient's feet, allowing the weight to rest on the balls of the feet, with the heels just off the floor. The nurse then places his knees against the patient's knees at the most lateral anterior aspect. This establishes a fulcrum point, allowing the nurse to gain greater leverage. While supporting your weight on the armrest of the wheelchair, lean the patient forward so that his head is over his knees. Holding the patient across the scapular areas at the skin folds, begin a slight rocking motion. As the patient's head breaks the plane of his knees, his weight is shifted over the center of gravity, reducing the resistance. This allows the patient's hips to be moved back into the chair with a minimal amount of force applied at the knees. Notice how he supports his weight and maintains correct body position when moving the patient, yet with very little effort. This procedure can also be accomplished by 2 staff members. The second person would assist the movement of the hips back into the chair, as you see demonstrated here. The hip-up should be used only after the procedure is explained to the patient and the nurse is secure and confident with the technique. This task is a simple time saver that will help eliminate lifting in your daily wheelchair patient management. To accomplish this task, place your hands on the push handles and your foot on the tip bar. By applying pressure to the tip bar and slowly pulling the wheelchair back, the patient's weight will be displaced behind the wheelchair's center of gravity. While holding the wheelchair with one hand, place the other hand on the patient's back between the scapulae and gently apply upward pressure. This reduces the friction between the patient's buttocks and the wheelchair seat and allows the patient to slide back into the chair without difficulty. As you return the front of the wheelchair to the floor, place your foot on the tip in order to counteract the force of gravity on the wheelchair. For safety and following a physician's order, a patient must occasionally be restrained while in a wheelchair. But if he slides down while in the restraint, it is uncomfortable for the patient and difficult for the nurse. One alternative you may wish to consider is the use of a restraint in the form of a figure 8. First, lean the patient forward and place a rolled sheet behind his back at waist level with equal ends available. Crisscross the ends and place the bottom end under the patient's thigh, and do likewise with the other end. Bring each end to the outside of the thigh and behind the wheelchair and tie the ends together. This provides a harness-type restraint, preventing the patient from sliding his hips forward and possibly falling to the floor. Remember to be cautious, as with all restraints, to allow room for movement and unrestricted blood flow. Always review your facility's procedure manual before applying any restraint. Let's now look at alternative methods of returning a fallen patient to the wheelchair. One of the most difficult things for a nurse to do is to return a patient to the wheelchair from the floor without injuring the patient or the nurse. This has always been a difficult task to accomplish in itself before even considering proper body mechanics. In the next segment, we will look at some alternative methods for lifting a patient off the floor and at the same time identifying proper body mechanics. We acknowledge that each technique will not be acceptable in all situations and therefore offer alternatives to the methods you may currently be using. After examination confirms that the patient has not been injured, he is ready to be moved. First, cross the patient's arms across his chest in order to protect them and reduce drag. If the patient is resistive or combative, restrain them briefly. Next, lay the wheelchair on its back at the patient's feet, with the push handles resting on the floor. Raise the patient's buttocks off the floor by lifting at the ankles, while the other nurse slides the wheelchair until the backrest is as far as possible under the patient's back. The legs are then draped over the edge of the seat. Again, be sure to lock the wheelchair. Both nurses will then kneel on each side of the wheelchair with the nearest the wheelchair on the floor and the foot of the other leg on the floor. This position provides the best possible base of support. Now, with the hand nearest the patient, grasp the push handle as if you were to shake someone's hand. With the other hand, support the patient's head and neck for safety and comfort. With one person acting as the leader, lift the patient and the wheelchair to the upright position. Remember, applying pressure with your foot and leg reduces strain on your back and arms. At 45 degrees from the floor, which is the halfway point, the energy expenditure of the nurses is reduced. Leverage and gravity generate inertia, allowing the patient to gently slide into the chair safely and comfortably. As this procedure is completed, note the reduction in lifting has been saved for the nurses. Also, observe the principles of correct body mechanics and good body alignment that have been demonstrated with this technique. In the case of a heavy patient, the same technique can be used with an additional person. Simply have the third person kneel at the patient's head, supporting the head, neck, and shoulders with both hands. As the leader counts, the third person also lifts, assisting the others as shown. The wheelchair method of lifting a patient off the floor is by far the simplest method to use. However, there are areas where it would not be practical due to limited space, and for these situations you may wish to consider another alternative. First, make sure you have properly assessed the situation to determine where the patient will be placed once he is off the floor, into a wheelchair or a bed. Have the destination parallel to and as close to the patient as possible. For this demonstration, we will use a wheelchair. First, lock the wheelchair. Now, remove the armrest next to the patient and both footrests if at all possible. Fold the patient's arms across his chest and restrain if necessary. Place the patient in the bent leg position with his feet firmly on the floor. A second nurse assists the patient to an upright sitting position. Using a rolled sheet placed around the patient's waist, form a figure 8, looping the ends under the patient's thighs and up through the waistband formed by the sheet. This, in effect, forms a secure harness located at the patient's center of gravity. Notice the body alignment of the nurses. Placing the nurse's knees against the patient's knees provides a point of leverage or a fulcrum. He then grasps the patient at the scapulae behind the armpits. From this position, the nurse can then counterbalance with his own weight over the fulcrum or patient's knees. As the combined weight shifts over the center of gravity, the patient's hips will rise off the floor. The second nurse, working behind the patient, will grasp the sheet and the waistband where they intersect. As they work together, she will assist with the lift slightly, but more importantly, she will act as a counterbalance and will guide the patient's hips to the wheelchair seat. Let's now review techniques of bedside safety. One nursing procedure that can cause considerable problems and possible back injury is turning a patient in bed. Before turning a patient from the supine to the side-lying or decubitus position, always tell him what you are about to do. This will reduce anxiety in the patient and could elicit his assistance if he is capable. First, raise the bed to a comfortable working height. This reduces the amount of bending for the nurse and can provide much-needed lever advantage to turn a patient. Also, always lower the side rail. To turn a patient onto his right side, first cross the patient's left arm over his chest. This eliminates drag and prevents possible injury to the shoulder. Now, tuck the right hand under the right buttock to facilitate the turn and to reduce the possibility of obstruction of the turn by the hand and arm. Flex the left knee with the foot resting on the bed. Pressure applied gently to the lateral aspect of the knee with the left hand begins to rotate the hips. As the hips are rotated, support the buttocks with the right hand. To prevent the hips from turning back, support the buttocks with the left hand as well. While supporting the hips in this manner, shift the right hand to support and turn the shoulders, continuing to turn the patient. This method of turning a patient exposes the entire backside for treatment. For longer periods of positioning, pillows can be appropriately placed. In order to turn the patient toward the nurse, the same energy-saving procedure can be accomplished in the opposite direction, as demonstrated here. Moving a patient from one side of the bed to the other can be a difficult task, especially if you are short of staff and help is difficult to find. One possible alternative to the method you may be using now is the bounce method. Before moving the patient, evaluate the situation to determine what needs to be done. Always explain to the patient what you are about to do, and remember to elevate the bed to a comfortable working height. From the foot of the bed, shift the patient's feet in the direction of the move. This increases the angle of the hips in the direction of the move and reduces friction. Fold the patient's arms across his chest. This is important in that it reduces friction of the arms on the linen and also reduces the risk of possible decubitus ulcers from developing. Hold the patient at the hips, where the best control is gained. Gently bounce the patient on the mattress. If the patient is heavy, begin this motion by pushing his hips downward, allowing the mattress to recoil. When bouncing a patient in this manner, you will notice that on the upward motion, the patient's body weight is displaced and friction is greatly reduced, allowing for more freedom of movement. Once momentum has been established, move the hips to the edge of the bed. For good body mechanics, bend the knees slightly and brace them against the bed for better leverage. To complete the task, move the shoulders to the edge of the bed. For a large or heavy patient, 2 people might be required to accomplish this procedure. The only difference will be the use of a folded bed sheet placed beneath the patient. Begin, as always, by explaining to the patient exactly what you are about to do. Raise the bed to a comfortable working height. Move the feet and legs to increase the angle of the hips, as we did before. Lower both side rails. Fold the patient's arms across his chest. Again, this is important in that it reduces friction of the arms dragging on the linen and also reduces the risk of decubitus ulcers from developing. Remove the pillow. With the folded bed sheet or a draw sheet placed under the patient, tightly roll the ends toward the patient and leave only enough exposed to comfortably hold on to. Notice the nurse's body alignment, straight backs, bent knees, and wide base of support. As the leader commands, bounce the patient using the folded sheet. As friction is reduced with the upper motion of the bounce, draw the patient to the edge of the bed. Now move the head, neck, and shoulders. 3 moves and the patient is to the edge of the bed and ready for transfer. The bounce method can also be used to return a patient to the head of the bed. This procedure can be used to move a patient who can assist, allowing the nurse to use minimal physical effort. A trapeze bar should be used for better results. First, remove the pillow from under the patient's head and place at the headboard for protection. Place the bed in the Trendelenburg position or elevate the foot of the bed to allow for gravity assist. Flex the knees upward with the feet flat on the mattress. If possible, have the patient hold to the trapeze bar and push downward with his feet. Holding the patient at the hips, at the center of gravity, Gently begin the bounce and allow the resulting momentum to move the patient upward in bed. Notice how easily this is done when the nurse utilizes momentum and leverage to reduce her workload. Observe how her hands are placed at the patient's center of gravity for the best possible leverage. Now, adjust the patient to a comfortable position. For a heavy patient, the bounce method can be very easily accomplished, following the same basic procedure as before, using 2 nurses. With the bed in the Trendelenburg position, place the pillow at the headboard for protection and flex the knees upward. This eliminates friction of the legs against the sheet and reduces the amount of work. Using a folded sheet placed under the patient, roll the edges in tightly towards the patient's body. Hold at the edges of the sheet near the shoulder and near the hips. As the leader commands, gently bounce the patient, allowing momentum to draw the patient to the head of the bed. These procedures work particularly well with large patients who are difficult to manage, and yet allow the nurse to use good body mechanics while reducing her workload. Now that we have reviewed bedside safety techniques, let's focus our attention on transfer techniques. When instructing a hemiplegic patient to prepare for a transfer, you must always assess his functional ability. Once it has been determined that he can transfer with minimal or standby assistance, the patient should be encouraged to do as much as possible for himself. Your presence will help reduce his anxiety, which will help promote a more successful transfer. In transferring a hemiplegic patient from a wheelchair with minimal assistance from the nurse, the pivot transfer is a very useful technique. First, place one hand on the armrest of the wheelchair and grasp the patient behind the knee with the other. With equal force, push against the wheelchair and pull the patient's leg using your body weight to gain leverage. Repeat this movement with the leg, allowing the patient's hips to move forward in the chair. Place the patient's feet back slightly so that his heels are just off the floor. Determine the weakness of the involved lower extremity and place your knee against his to gain stability and to prevent it from buckling when he stands. With your hand supported on the wheelchair, lean the patient forward to allow for his head to be positioned over his knees. Place one hand under the patient's involved upper extremity and grasp the patient about the scapular area, and the other hand in likewise fashion. At your direction, the patient pushes off with his good arm and leg. Using minimal assistance, stabilize the patient's leg and upper body by placing one hand on the shoulder of the involved side, pushing away. With your hand on the buttocks pulling forward, brace the patient's knees to buckling. Now the patient takes one step forward with his good leg, and a pivot transfer is completed without difficulty. And remember, never allow a patient to hold you around the neck. For the remaining segments on transfer techniques, it is vitally important that you understand how to apply a sheet properly in the figure 8 fashion. This is important for the safety of both you and your patient. Begin by leaning the patient forward in the wheelchair. Place a rolled sheet behind the patient's back, waist high with the ends of equal length. Crisscross the ends and place the bottom end under the patient's thigh and bring it to the outer side of the thigh and up under the waistband. Proceed in likewise fashion with the other end of the sheet. When using a sheet in this fashion, important at all times during the transfer activity to hold it where the ends intersect with the waistband. This harness, used in the proper way, provides a safe and secure transfer belt. Now, let us see how we can use this transfer belt. We generally do not recommend anyone transferring a patient alone, but sometimes it is absolutely necessary. Previously, we saw how to transfer a hemiplegic patient who could do most of the work himself. Now let us look at another type of transfer technique using one staff member. In this case, the patient is less mobile and it will be necessary for the nurse to do more of the work. Bedsheet to the patient as previously described, he is now ready for transfer. First, move the hips forward in the chair and move the feet slightly so that the heels are off the floor and the patient's weight is resting forward. Bracing your knees against the patient's knees to form a fulcrum, as we did previously, lean the patient forward in the chair. As with any transfer, proper positioning and placement of the hands is very important. Place his head next to your side and under your arm away from the area to which he will be transferred. This will reduce the distance his hips must move during the transfer. Then place your hand under the patient's arm and grasp the harness formed by the sheet. The other arm is placed over the patient's shoulder and the harness is held in a similar manner. Remember, the patient's head must always be placed away from the direction of the transfer. As you slowly lean back, using your weight as a counterbalance, pull the patient forward. The patient's weight will then shift over his center of gravity, allowing his hips to rise out of the chair. The nurse will then pivot, turning the patient's hips, and the transfer is completed. Now, let us see how we can transfer a totally dependent patient using two staff members. Always assess the situation and tell the patient what you are about to do. Then, equalize the height of the bed with the wheelchair and remove the armrest and footrest. The sheet is in place in the harness fashion as previously described. Move the patient's hips forward in the chair to provide greater leverage. This may be more difficult with a dependent patient. As you lean on the wheelchair supporting your back, reduce the resistance by lifting the patient's leg up and off the seat before pulling forward. Lifting the leg in this manner reduces the resistance of the leg against the chair, and the patient moves more easily. Place the patient's feet back underneath him so that his heels are just off the floor. The nurse in front will block the patient's knees with her knees, forming a fulcrum or leverage point. The nurse behind the patient then pushes the patient's upper body forward, pointing his head in the opposite direction of the transfer. The nurse in front then grasps the patient across the scapulae at the skin folds of the axilla. The nurse standing behind the patient will then position herself so that she can comfortably straddle the wheel closest to the bed with the push handle resting against the outside of her hip. This is done to help stabilize the wheelchair and to prevent her from leaning over the push handle. She then holds to the sheet at the positions as previously discussed. This position allows the nurse to work close to the area where the patient will be transferred, thus producing greater leverage. At the command of the leader, the nurse in front will use her weight as leverage, bringing the patient's center of gravity forward, allowing his hips to rise out of the chair. At the same time, the nurse behind the patient will provide counterbalance, reversing the momentum and pulling the patient's hips to the targeted area. With this transfer technique, you have utilized leverage to reduce the amount of weight you must actually move. This technique eliminates lifting in the patient transfer. To transfer a patient to a higher level, such as a treatment table, the same two-person transfer technique can be used. The most difficult task in moving a patient to a higher level is getting the hips to the height of the targeted area. To do this, simply elevate on a small footstool and employ the same procedure. Elevating the feet provides a higher leverage point at the knees, thus allowing the hips to reach a height that is normally difficult to reach. Although these transfer techniques may be new to you, they are not difficult to execute. However, a thorough understanding of the principles must be developed before attempting them. practice these techniques with each other before ever attempting them with a patient, and always make sure these techniques are not contraindicated. This presentation has been designed to encourage good body mechanics in the healthcare field. It is also important that proper nutrition, physical fitness, and good judgment be a part of your daily routine. Studies show that nutrition, fitness, and good body mechanics are important factors in reducing back injuries. If your back is weak and you occasionally have aches and pains that are annoying, you should do something about it now. Don't wait until it's too late. Chances are, if you don't do something about it now, your back could get worse. There is a proper exercise program for nearly every back problem, and back pain can be reduced by therapeutic exercise. Your doctor and therapist are the best people to advise you on the proper exercise you should use. Whether you have had a back injury or not, now is the time to begin an exercise program that will strengthen your back and abdominal muscles. This will make you much less likely to have back problems in the future. An exercise program for prevention of back injury, and in some cases for treatment of back injury, is the Williams Low Back Flexion Exercise Program. These exercises will stretch as well as strengthen the muscles of the back. If you are recovering from a back problem, follow only the exercises your doctor has recommended to avoid possible further injury. And remember, an ounce of prevention is worth a pound of cure.